co-founder of the university-wide initiative on forced displacement in collaboration with academic, public, and private sectors in Lebanon, Uganda, and Colombia. He has over 130 peer-reviewed research articles, and he's the author of 2 books, Bitter Pills, Oxford University Press, 2018, and Biography of Resistance, The Epic Battle Between People and Pathogens, HarperCollins, 2020. He's also a prolific writer in international newspaper columns that have appeared in 30 countries and have been translated in 8 languages. Biography of Resistance appeared in April of this year, and its timely message became especially painful, given the loss of life that we have seen during the COVID pandemic. Over 1 million deaths, loss of life, and 36 million cases worldwide. His book addresses the history of antibacterial resistance and covers a broad trajectory of important moments in the lives of researchers, their ingenuity, their competition, their challenges, and their vision. The stories are inspiring, and they carry a strong message that encapsulates the pedagogical vision, and they carry a sense of what it means to be a global citizen. The message of the book is that only solidarity, ingenuity, and caring for others can minimize not only the ongoing threat of new diseases and pandemics, but also the threat of bioterrorism, securitization, and weaponization of global health. The book is impressive in its historical and geographical scope. Stories of famous researchers take us from Norway and United Kingdom to Germany, India, Pakistan, the Philippines, Japan, Vietnam, Venezuela, Mexico, South Africa, France, Lebanon, Bangladesh, and others. Historical figures, politicians, and peacemakers enter the stage of biography of resistance, from Theodore Roosevelt and Franklin Delano Roosevelt to Dag Hammarskjöld and Napoleon III. Muhammad is, in our view, an exemplary educator and guide to future leaders. We were fortunate to visit Kilashant Honors Program with Marios Dikiakos last year, and we were impressed with the spirit of solidarity, commitment, and optimism of the students. What is also very impressive is the solidarity of the program's faculty, who come from almost every department and school of Boston University, teaching students to learn the language of different disciplines, from humanities and natural sciences to economics and global health, so that they can expand their understanding of how we envision the university of the future. With this, I turn now the discussion over to Mohammed and Marios, who will moderate the discussion. Thank you.
Thank you so much, Anastasia. It was incredibly generous of you. I feel as if I am with family. I've had the tremendous pleasure of coming to Cyprus about a year and a half ago, almost 2 years ago, and then Marios and Anastasia were here in Boston, and we were delighted to have them not only in Kilashant but also at our home. So it's a feeling of tremendous, I think, respect and admiration, but also of family, and recognizing that I feel that I'm among a group of friends and family. And with that spirit, what I would encourage our colleagues who are at least on Zoom to interrupt me at any point. I don't want this to be some kind of a one-dimensional seminar where I am the only one talking, but I hope that this will be a conversation. So one of the things that has happened in the last 6 months is that I can at least do a little bit of multitasking on Zoom. So if there are questions that keep coming in the chat column, I'm sure Marios will channel them to me, but I'm also able to look at them directly. I want to talk to you about some of the work that we've done in the last several years, work that will hopefully continue to grow in partnership with colleagues at the University of Cyprus. thinking about designing ethical solutions for communities that are forcibly displaced. Here, I mean communities that are displaced because of conflict. In your neighborhood, that happens to be in Lebanon, in Palestine, in Syria, but communities that are also displaced, not across international borders, but also within the country. So, for example, the challenges in Yemen. Both of these are driven by conflict, but we now know and recognize, and Anastasia has done a lot of work in this, the importance of challenges of forced migration because of climate change. Unfortunately, these things are not working in isolation. Oftentimes they are sort of reinforcing each other and working in confluence. In the case of Yemen, for example, this is an issue that you see, and certainly in the Horn of Africa as well. I also speak at a time of deep social and political anxiety, certainly in the country that I live in the United States. And one of the messages that Anastasia talked about of this notion of increased nationalism that is pervasive, certainly in the United States right now, but elsewhere as well, that in many ways has compounded and made the challenges of forced displacement even more acute. Me first, my country first, my tribe before everybody else. That kind of sentiment has unfortunately made problems even worse. In the backdrop of this, my conversation today is about some of the work that we have done. Certainly a lot of this had started before COVID, but I'll bring some of the concepts of COVID, of how these problems are even more acute. Before I do that, I want to tell you a little bit of a story, a sort of a history of the world that I inhabited when I was growing up. So I was born in 1977. About 2 years after I was born, almost exactly 2 years, 2 years and 1 month, this was the cover of New York Times, talking about something that was happening at the western border of Pakistan and Afghanistan. And this was the challenge of Soviet invasion. A day later, we saw the government fell, and the formal Soviet invasion started. With that, there was a mass influx of refugees coming to Pakistan. Pakistan happens to be on the western border, and again, because of Soviet invasion, there were new and upwards of several million Afghan refugees that came to Pakistan. It would be incorrect to say that Afghans weren't coming before, or it would be incorrect to say that this was the only time that had happened, but this was a large group of people that came over a short period of time. And with that, of course, came the challenges in Pakistani community. Some were generous, some were kind, many were not. People in my own neighborhood, people in my own family were hostile, if not in actions, then certainly in thoughts. Afghan refugees, even to this day, are considered to be a source of Pakistan's myriad problems, from health to social services and certainly security and terrorism. I think it would be incorrect to say that there have not been problems, but to blame the entire community as a whole is extremely problematic, as you would agree. And the challenge with that is that we never really owned our problems. And I grew up in that environment, and I am ashamed to admit that for the longest time, I didn't really think that was just not problematic. It took me a long time to realize that. They were forced to live in places like these. No shelter, no structure, largely tented settlements with a tremendous amount of chaos. This is not very far from where I grew up. So today, in the backdrop of my own personal history, I want to talk about 4 main themes. The first one is, what exactly is the problem of forced displacement and size and magnitude of that? The second thing that I want to talk about is, why is STEM, so science, technology, engineering, mathematics, absent from a larger conversation on forced displacement, and how has that become worse in the context of COVID? Reflections on our own work in refugee health. And finally, the point that Anastasia mentioned, building a coalition. How do we scale these ideas that may be in the classroom, that may be in the lab, that may be in a single company or in a single department? This data is from last year, and unfortunately, it is that may be in a single company or in a single department. This data is from last year, and unfortunately, it is much worse now. About 71 million people have been forcibly displaced worldwide. The actual number might be even larger. Out of this, a significant number is in internally displaced people. Whether this number is the greatest ever in history or not is a subject of debate. But that debate today is somewhat irrelevant to a certain extent, because this is a problem that continues to grow with no end in sight and no effort to address the root causes. I'm not going to talk about the sociological element of that or the economic one, but one that is closer to my own area in terms of thinking about science and science policy and innovation, and what role do we play in that domain. To put it in perspective, this means somebody is displaced out of his or her home every 2 seconds. And again, this is just a reminder of the gravity of the problem that we see all around us. Another dimension of the problem, and this might be something that you all can relate to as well, is the disproportionate number of refugees that are housed in a few countries, and the fact that most of those countries are low or middle income countries. The only exception to that is Germany, and that also has only changed in the last 7 years. Countries that I have worked in Pakistan, in Lebanon, more recently in Sudan and Uganda, have a very high number of refugees. And with that comes the challenge of not just refugee well-being, but also development. Communities in Pakistan were concerned that they were already poor, and now they have this additional challenge. Communities in Lebanon have had to feel the same way as well. And to a certain extent, that feeling also exists in Europe. Not to sort of support the extremist ideology here of sort of scapegoating people, but the argument itself is worth revisiting of how do you protect the local communities, and why should it not be a global responsibility as opposed to responsibility of half a dozen countries to address this global calamity. In the United States, the condition is absolutely unacceptable. In 1980, there were 207,000 refugees, almost 250,000 refugees who were admitted. The number in 2019 was 15,000, and even that wasn't met. One person from Yemen, a war that is led by Saudi Arabia and supported quite a bit by the United States, one person from Yemen was given a refugee status, one. This gives you a context of where we have come and how deeply and morally problematic that might be. The problem of COVID has only made this problem even worse. In a place like Yemen, and I'll keep coming back to some of the work in Yemen because we've been involved with UNICEF and some other agencies there, is particularly problematic because it's a country that has been facing the sort of assault of climate change, of conflict, and now of COVID, to the point that the sort of government in northern Yemen, and I don't want to use the word rebel for any group in the south or in the north, I just say sort of the warring parties. One of the warring parties that is in control of part of the country has even refused to accept that there is a problem of COVID in the country. Tens of millions of Yemenis are devastated by war and COVID. This is from the United Nations. And I'll keep coming to that, partly because the existing health infrastructure doesn't exist, because nutrition problems are already so bad that this is really going to decimate whatever little structure there exists. Then there are new challenges of COVID-19, and I'll come to how we are thinking about it. One is, of course, the politicization of COVID. And this is not just in Yemen. This is also in the United States, as those of you who may have seen the news in the last couple of weeks may have seen that. There is reduction in international aid, and there's likely to be additional reduction. The health infrastructure is tremendously stressed. And it is stressed because you have hospitals that cannot handle COVID patients, but people who may have other health challenges are being turned away as well, right? Those diseases have not gone away. It's a matter of perspective of what we choose to focus on. And some of the other challenges have now been sort of relegated to the back of our mind. And of course, there are then challenges associated with global supply chains. One of the challenges that we, at least in our work, are seeing increasingly is the proliferation of fake, counterfeit, and substandard medicines and therapeutics. And I'll talk a little bit about how to think about those. I want to address first thing head on. Oftentimes you do not hear somebody from bioengineering or engineering and sciences to talk about the issues of refugee health or internally displaced communities. Part of it is because people think that these problems don't have any scientific component. And my argument here is to sort of have a pushback on that, because there is a need for ethically appropriate technologies. And we've seen that in the context of COVID. We need technologies that are that will maintain privacy, that will respect your human dignity, but are also able to work at the point of care. Of course, there are tremendous amounts of data access and privacy concerns, which require thinking not just from ethicists, but also scientists, engineers, and research scholars of innovation. An issue of antimicrobial resistance that I'll talk about today only continues to increase. And of course, communities that are vulnerable, that are socioeconomically disadvantaged, are often the first ones to get a hit on that. And of course, area of trauma and mental health that are unique to communities that are displaced. Out of these, I'll only talk about the first one, point of care technologies, and the third one, antimicrobial resistance. I do not work in trauma and mental health, but I hope some other colleagues may have thoughts on that as well. The absence of new ideas from scientists and engineers means that existing ideas get reinforced. Those ideas may or may not be the right ones. Those ideas may never have been tried before, but they exist because there is no replacement, because people like me in science and engineering have decided to give up on this or have decided not to pursue. So that continues to be a challenge. And then there are bottlenecks in innovation. The first one is there are few funding opportunities. Oftentimes science and research is driven by new funding opportunities, and there are few for scientists and engineers to work in this. But my argument to that is that funding opportunities are not in a vacuum. When people argue for those, new opportunities are created. About 20 years ago, when I was a graduate student, global health was not something where engineers participated, but a number of research scholars made considered effort to really raise the profile of that set of questions. And now there's a lot more funding than there was at that time. And I think we need to do the same in this regard. Traditional approaches in STEM disciplines are based on silos and individual hypotheses, which are very, very challenging because you cannot run control experiments in these environments. So we really have to rethink that. And again, this is not a problem, but an opportunity for intellectual and philosophical contribution. And finally, in general, there is a perception and lack of awareness. And our students are not aware that there are opportunities. And again, these in many ways are a critique of myself and my colleagues, that we do not do a good enough job training our students who, in a few years' time, when they'll go and become professionals themselves, are going to embrace and look at these challenges. And my hope is that in a conversation like this, we'll get a chance to reflect and think about how to create new technologies, how to sort of think about some of these questions and increase awareness on these challenges. So I want to start with the same picture that I showed you a few minutes ago of an Afghan refugee camp not far from my home. One of the questions that oftentimes comes up, and since this is a sort of a seminar on entrepreneurship and innovation, is how do you develop trust? These communities that are marginalized, these communities that are vulnerable, these communities that have not been treated very well, how do they trust and who do they trust? And can you create solutions that will create that trust and maintain that trust? And I'll give 3 examples where we're trying to develop that, and hopefully we'll get somewhere. We're not there, but that's something that keeps coming up. There's a sense of distrust and mistrust against authorities, against outsiders. And that's an important part, oftentimes not thought of when you are dealing with vulnerable communities. One of the things that has become even more challenging in the context of COVID is that communities that are vulnerable are also now much more likely to get poor quality medicines or poor quality technologies or poor quality diagnostics, fake and substandard and counterfeit drugs, which means that it is going to further erode that trust. Whatever little trust you had, it is going to impact that even more. So something for us to think about as we move forward. And of course, many of these places are still facing conflict, where a healthcare system that is already weak gets attacked even more. Whatever little is available may also have trust issues. So how do we sort of make sense out of that? I want to sort of talk about the issue of quality of medicines here. These are just examples of poor quality medicines that are often available in low income countries. The top left figure is from Lahore, from where my father was born and grew up, of drug manufacture. The top right figure is one that I took myself. The expiry date you can see is October, and I took it next March, and this hadn't even reached the market yet. So by the time it would reach market, it would already be 6 months before it expired. Bottom left is intentional falsification of a fake drug, and bottom right is sort of lack of regulation. So counterfeit and substandard drugs are a global challenge, and they've become even worse in the context of COVID. Even before COVID, it was estimated that they would cause about 500,000 deaths annually. Now, just put this in context, COVID has caused 1 million deaths, an absolute tragedy. But 500,000 deaths every year because of poor quality medicines, largely in low-income countries. And then they contribute to antibiotic resistance, a problem that is affecting all of us. So I want to sort of wear the scientist hat for a second, if you allow me, because I want to build the case of the technologies that we are developing and why they matter. So AMR stands for antimicrobial resistance. And one of the things that my research group has done in the last few years is to directly connect poor quality medicines and antimicrobial resistance. Historically, antimicrobial resistance has been studied in the context of bad patients who don't take the drugs when they're supposed to, who take the drugs when they're not supposed to, doctors who prescribe or overprescribe, pharmacists who are willing to sell these things. But all of these things are absolutely true. But then there's another problem as well. And the problem is that what if somebody is a good patient and takes the drug on time, but the system fails her or him, that the drug that that person took was fake or substandard or did not have the right active ingredient? It's not the fault of the patient. And that's often what is something that we see in low and middle income countries. So we wanted to scientifically make that connection and prove it, which is something important if you want to sort of change that policy. We started with one of the drugs that is used often in a disease scene in low-income communities of tuberculosis, TB. And in that, there's a drug called rifampicin that we studied. I won't go through the detail of sort of all the biology of this, but I have these slides and I'll send them to Marios so that others who may be interested can see some of the technical details if it is of interest to them. The way we studied the system was rifampicin degrades in the presence of sunlight or moisture or poor manufacture. So what we did was we said, okay, we are going to look at this drug and see if it degrades. The degradation that is often seen in low-income countries or low-income communities, does that lead to development of resistance, right? Because this degraded form of the drug is often present. Can the presence of that degraded form lead to the development of resistance? And we used a system called of bacteria called E. coli, which is a standard lab system, where we were able to demonstrate that the presence of degraded product, even in trace amounts, can lead to resistance development. Actually, that is much, much faster. So on the left-hand side is rifampicin. On the right-hand side is rifampicin quinone. White means the bacteria is growing very fast. Black means it is not. As you can see on the right-hand side, that the growth is actually much faster on the white side. We looked at multiple sort of trade names and products. We looked at other kinds of bacteria. And in every single case, we found the same answer, that the presence of degradation products leads to resistance development, to the point that once that resistance develops, you can give good quality drug and it wouldn't matter anyway. I won't go through the detail of the mutations, but I want to sort of talk about another drug, one that we all may be more familiar with, and that's Cipro, or fluoroquinolone is the name of that category. Cipro is a drug that we are more familiar with. I'm going to talk about sort of countries such as Pakistan, Lebanon, Jordan, and compare them to Massachusetts. If you look at the sort of scale of the things in Massachusetts, prescriptions per 1,000 are pretty much flat over a 20-year period. In Lebanon, they're increasing. In Pakistan, they have increased at least 4 to 5-fold, and about the same in Lebanon as well, and in Jordan as well. So you are prescribing these drugs a lot more per unit population. And then there are issues of quality as well in these places. In Uganda and the refugee camps, this was taken just a few months before the COVID outbreak. These drugs were freely available, of course, not freely in the sense of without cost, but were stored poorly. There was no checks and balances, and you could buy any of them anytime, and their quality was quite suspect as well. When my postdoc, Carly Ching, did the experiments, what she found was that the exposure to poor quality drugs increases not only resistance to Cipro, but a whole bunch of other drugs, chloramphenicol, tetracycline, ampicillin, that have nothing to do with Cipro. So a low zone of inhibition means that the drug is acting in a smaller and smaller zone. And that sort of told us that people who are exposed to poor quality drugs that are going to be, unfortunately, only increase in the context of COVID. And again, as I've mentioned before, these results are before COVID, are going to be even more vulnerable. So now I want to sort of move to innovation and technology side of things. Can we detect poor quality medicines through technology development and save vulnerable lives? Again, this is a project that has been going on for quite some time. Existing technologies are either bulky and qualitative, so they do not give the exact answer, or can be anywhere from $50,000 to $70,000 or $80,000 per technology. And of course, when you look at typical market-based solutions, nobody is going to invest in a technology that is going to work for the people who are at the lowest end of the spectrum. And I do not have the answers to all of those things, but I do wonder and worry about some of that. So out of that came our technology called PharmaCheck, where the idea is that we want to improve access to good quality medicines and improve the quality of life around the world, regardless of gender, race, financial capacity, and any other discriminatory criteria. And for us, because I do not have a company in this, at least not yet, our goal is both research and sort of policy change. We want to understand, where do poor quality drugs come from? What are the gaps? What are the bottlenecks? We certainly are very interested in technology innovation, coming up with new technologies, but we also want to use that technology for policy development, because at least when it comes to the lowest sort of socioeconomic bracket, low-income communities, policy development is the avenue which we want to strengthen. Small-scale solutions are going to be important, but they need to be integrated into the policy framework. And there is sort of a role that innovation has to play in that policy. And of course, a long-term goal is to reduce adverse health outcomes. Just a little bit on what the technology does. It accurately and affordably tests quality of medicines at all points in the supply chain and the field. It is basically a microfluidic platform where the user just has to put in the drug, and we have developed these fluorescent molecules that bind together with the drug and give off a light signal that can be detected. A criticism, which is a valid criticism, would be that do you have fluorescent molecules for all the hundreds of thousands of drugs out there? And the answer to that is no. But we do have fluorescent molecules for some of the leading drugs that are life-saving commodities and are known to be substandard or counterfeit. But we are sort of expanding this platform and sort of the overall number of drugs. The idea is that it would have a simplified user experience. You have a little cartridge, which comes pre-filled. You put it in the system, and it's the size of a little suitcase, about 10 to 12 pounds in weight. We can do all the malaria drugs right now. We can test them, and we can test them quantitatively. So that is important. And now we're sort of expanding our work to antibiotics. One of the things that happens, and again, this is again another story from a refugee camp not far from the one whose picture I showed, is the problem that many people will have drugs that are just poorly manufactured. And this is what was seen in early 2000s, where they saw that there was a spike in malaria at the border between Afghanistan and Pakistan. And that happened in the summer months. So June, July, August of 2002, and really peaked in August, September of 2003. And it turned out that the problem was that the drugs actually had the right active ingredient, but they weren't being released. So that was another area in which we wanted to sort of contribute, and that was sort of development of a mechanism to test whether the drug is going to be released from its pill. So it may have the right ingredient, but if it is not released in your system, then basically it is no different than just taking a marble pellet that just sits there. And so we can do that as well now with our technologies. This is sort of just a comparison of where we are. Our technology is better than the WHO recommended technology, and certainly within 5% error of the gold standard HPLC. So these are some pictures of us training workers, frontline workers in different countries. This is Alfred, a friend of ours who has been working very closely with us. He's a research technician at a lab in Ghana, and has been working closely with us in terms of developing technologies. Both of his kids have had malaria. And for him to get a sense on whether or not the drugs that the kids get are good or are reliable is important. So it's empowering people like Alfred to be able to understand that their new field standards and the results are relevant at the community level, and certainly at a much lower cost. I told Marius that one of the things that I'll talk about, well, many things that I'll talk about are things that I don't know the answers to. One of them is, what should be the right business model for something like this? How do you scale this? Currently, trusting of drugs in low-income communities or low-income countries is almost non-existent. The Medicine Regulatory Authority in many parts of the world are testing at sort of random, not in a very systematic way, and usually it is hampered by the presence of many factors, political, economic, other factors. We, as sort of a group of people, decided that we don't want our technology to be consumer-based. In other words, I do not want somebody who's had to walk 6 miles with the sort of tremendous economic pressure to buy a medicine and then also have to pay to test that medicine. I believe that that should be done upstream. That should be done at the institutional level. The consumer who's getting a medicine or buying the medicine should not also have to pay for testing it. So we have decided to move our technology upstream. But where should it be? And what's the right point? And how do we scale that in the world, in the COVID world, where drugs need to be tested more, and the supply chains are even more disturbed and sort of no longer intact? I don't have an answer to that question. We have some thoughts. I'm also working directly with the government of Uganda in their effort to improve testing, and the government of Pakistan, but we don't have the answers. And certainly, I would love to sort of get your thoughts of what's the right point. We cannot test at every single point. The cost of that would be enormous. But who should be held responsible for drug quality testing? Companies? And it seems almost idealistic to talk about companies, but think of it this way, that companies happen to be largely in India or China or Germany or United States, and the countries receiving them have almost no leverage to force these companies to do testing, almost none. As a matter of fact, they can be a disadvantage to testing or pushing these companies, because the whole world of development is so intertwined that if you really push hard on country X, other development projects may get sort of slashed or maybe put on hold because they may feel that you're embarrassing them. And I have many stories in my books that I've talked about some of these things. Testing medicines alone is not sufficient. We also need to make sure that people are getting medicines. So there's a science component. Bad medicines develop resistance, testing medicines, but also getting good medicines to the people who need them. Here I want to go back to the context of Yemen. Yemen is in a period of tremendous difficulty. I can't tell you how painful it is for me to read and learn their stories. We've been working there for a few years now, and how incredibly resilient and kind and generous those people are, whose total fault, by the way, is that they just happen to be Yemenis. I'm not talking about warring factions here. I'm talking about ordinary citizens. Yemen has tremendous financial need right now to continue. And because of COVID and other anxieties, the funding has been slashed. They wanted $2 to $3 billion for the next year just to maintain the very basic care, very basic. I'm not talking about hospital care. I'm talking about getting people ORS and zinc so that they don't die of diarrhea. I'm not talking about anything special here. And even that funding, only 40% of that funding came through. So per person funding is about 25 US cents. So that tells you the acute nature of the problem. We've had to sort of suspend some of our programs because there was nobody who was willing to work in Yemen because nobody was getting paid. So it's really an absolute and abject tragedy. It's a humanitarian crisis before COVID and even after COVID that is just unimaginable. One of the things that we are doing is developing computational models to identify where might be the hotspots where new outbreaks may emerge so that you may sort of direct your resources there of drug quality and drug delivery. And the question then becomes again the same of how do you scale that? Who should own that? One of the things that I deal with all the time is oftentimes I don't have solutions myself, and I rely on people like all of you to tell me what you think of how do you really scale these solutions. We have a I think a pretty interesting model of being able to tell the Yemeni NGOs and institutions that these are the places, given nutrition challenges, given historical outbreaks of cholera, given the climate change impact, given the destruction of infrastructure, where in the 6 months period, you may have an acute need. And we've been very good. But then you reach and hit a wall because people are not interested in doing that. So how do we solve that problem? Something for us to discuss. One of the things that really troubles me, and I'm really honored that Anastasia talked about that in the beginning and the introduction, is sort of this over-militarization of the world that we live in. The wounds of war are not going to go away immediately. And in places that I work, in places that have seen conflict, the need for new innovative technologies is even more. I'll give you an example. When the United States started the Second Gulf War in early 2000s, there was an outbreak of drug-resistant infections. The US Army has left most of it from that region quite some time ago. But the diseases are still there. In Lebanon today, most people who face trauma or in Iraq and elsewhere get infected by pathogens or bacteria that are resistant, and that resistance emerged because of that conflict. Hospitals, infrastructure were destroyed. There's no Marshall Plan coming in the Middle East to clean it up. The environmental catastrophe and damage is there permanently. And it's not only in the Middle East, it's also in Afghanistan. So how do we sort of create innovation and solutions to really think about some of these questions? And that's something that we've been discussing. And one way to do that is both local and global engagement. And this quest for ethical solutions and scaling that continues. And as an academic, as a professor, I feel that I'm hopeful that there are opportunities to sort of teach some of these open-ended, difficult challenges in the classroom, bring exposure to think about these in a different way. We want to create programs that expose our students to the grandest challenges of our time: refugee health and well-being, antibiotic resistance in refugee environments, urban poverty, access to quality care. All of these things were there before COVID, have become even worse, and have been sort of become even more prominent. We want to create programs in the classroom and outside which allow students to engage and learn from their peers through field work, but grounded certainly with ethics. And certainly the most important part of this is to engage with disciplinary rigor in ways that go beyond disciplinary boundaries. And this is something that Anastasia mentioned, my involvement with my colleague and a dear friend, Professor Kerry Preston, where we are thinking of how do we bring people together from arts and humanities, social sciences and public health, engineering and sciences, to really look at these problems in a much more holistic manner, to understand the historical perspective so that we can know how we ended up where we are and how we can do things differently in the future. These are just some pictures from our work in different parts of the world. We have created an immersive learning programs in Lebanon and Uganda and in Colombia, where we take our students who work with local students, because I think it's important for us to have peer-to-peer learning in that regard. And we are hoping that we'll be able to sort of bring our students from the University of Cyprus to the fold as well. This is just an example of the program that we have created in humanitarian engineering. And any of these courses that we create, there are several goals. First is we want to learn from experts. When we're talking about the history of the region, it doesn't need to be me. It shouldn't be me. Instead, it should be somebody who's a card-carrying historian of the region. Tremendous emphasis on peer-to-peer learning, that we are able to engage and work with our peer students, with other students and policymakers, and really sort of creating these environments. And certainly the importance of ethics in research and design and technology development and scaling. We want to live by the old Hippocratic oath of do no harm. And that is a central tenet of our work. We've been fortunate that some of these things have now sort of started to scale up a little bit. Governments have been interested, in this case, the Prime Minister of Uganda himself, and certainly in terms of bringing some accolades to this work as well. This has allowed us to create a university-wide initiative. There were two initiatives already, one on initiative on cities, and the second one was initiative on environment and sustainability. And this is the third initiative on forced displacement. I took this picture, this is my last slide. I took this picture when I was in northern Uganda, where there are South Sudanese refugees. And this is a health camp. And you know, it really bothered me to have a health service place that should be open and welcoming, but instead it had barbed wires and no shade except a couple of trees, and no real buildings, no mechanism. And that was very troubling. And I took this picture there. And I thought of a professor who was a faculty at Boston University. His name was Elie Wiesel. And he said that the opposite of love is not hate, it is indifference. And I have felt that people in my discipline in engineering and sciences and technology have for far too long been indifferent about addressing these things through ethical solutions and scaling those. So my hope today in this conversation is that we'll be able to sort of, if nothing else, we'll be able to at least overcome that indifference. All right, thank you very much.
Thank you so much, Mohammed, for this thought-provoking and very insightful presentation. We have some time for a few questions. I don't know if the audience would like to ask any questions, our students. If you feel challenged to ask a question in English, you can ask in Greek and I will translate. So you can unmute yourself and ask a question if if you wish.
I will start.
Yes, please,
okay.
Anastasia.
Yes. Thank you very, very much, Mohammed, for this journey to areas that we need to learn about, and we are always, just one moment, okay, now I'm here. No? All right, all right. Thank you, Mohammed, for this journey. These are areas that we want to learn, we want to understand, and our students especially who are participating here today want to know what is possible for them, given that they feel that there is so much control worldwide over questions about how refugees are going to be handled, pharmaceuticals, class divisions, racial divisions, religious divisions are becoming more and more severe. And there seems to be on the part of the, young people, at least the students we teach here in Cyprus, a sense that, the walls are closing upon them. And then you have these incredible messages in your book. I'm thinking especially about the history of Joanne Liu, Chinese immigrant, and you are tracing the way that she was able to challenge all of the hardships and eventually become the president of Doctors, Médecins Sans Frontières, so Doctors Without Borders. And you have these incredible cases of ingenuity and creativity emerging out of people who were facing all the odds against them, immigrants, marginalized, no money, and yet they found the strength and the ingenuity and creativity. And when I was reading your book, I felt that you are so hopeful about these communities. I felt, and I share that precisely because of the hardship, the human spirit seems to emerge victorious out of these hardships and to, envision solutions. So I wanted very much to convey these stories to our students. But in the meantime, I'd like to ask you, how is it possible to really convince our students that these paths are possible, regardless of all of the obstacles that they seem to face around them?
I think that's a great question, Anastasia. My sense is that we do lack concerted efforts, and I hope that we do need more leadership, I would say, in all sectors. And I think in general, we have sort of relegated the leadership issue to some communities and not all. So we don't expect our business leaders to take a leadership on this. We don't expect our scientific and entrepreneurship leaders to take a leadership in this. And I'm concerned that this will continue to be a siloed effort by some people like Joanne Liu and others, but not everybody, because I think we are shirking away from responsibility. I mean, I don't think there's any other way to describe it. And the criticism is merited on that regard. But you're absolutely right. I'm hoping that our students would change that and own this, and I'm hopeful of that, but it remains to be seen. I think it's hands raised, Marius.
Yes, thanks. So we have a question from Lizel. Can you please unmute yourself and ask the question? I see a raised hand on Zoom.
Yes, I'm here. Good evening, everyone. Thank you, Prof. Mohammed, for your very almost touching story that you've been telling. I had a lot of problems, to be honest. I had a lot of challenges that you brought up, and from the presentation, it's pretty clear that there's a big need in this area and a big need for solutions. I then also saw that you spoke about the farmer check solution that has brought, that you and your lab and students have come up with. And of course, my background is technology. I'm in the IT, information communication technology space. I was wondering if there had been initiatives perhaps where you've collaborated or presented to technology departments at universities or in the industry. Is there any work there that can bring, because as it stands, there's practically no solution that can exist without technology in the times we're living in. And I was just wondering if there has been any work in that regard in terms of teaming and collaborating with ICT departments that could help with brainstorming towards solutions for some of these challenges.
Lizelle, that's a great question. My short answer is that we have gotten a lot of interest from our colleagues in ICT departments. In some cases, it's more case-by-case basis and individuals who are interested. So we work closely with our colleagues at the Institute of Computing here on some projects. But I think in general, we have not had the same kind of broad integration as we would have liked. For example, I'll tell you a very specific case, which I still haven't figured out. A student of mine asked me that has there been a clear policy and a discussion on how to protect and how to sort of use the data that is generated from the cell phones of people who are forcibly displaced. And we spent a lot of time and we couldn't find any clear guidelines. There are bits and pieces here and there, but not as much, right? Not a clear sort of a framework, somebody saying, this is what we have seen, these are the challenges, this is how you address. So it's done still in a very ad hoc manner. So while I think there's a lot of interest, my worry is, and I'll be frank here, that we really have not paid attention to these questions as much as we would have liked. So that's what I would say continues to be an issue that we should embrace and bring more people into the fold. But hasn't happened as much. On a case-by-case, yes. As a discipline, a lot less so.
Okay, thanks for that. I'll be in contact with you and see maybe how we could get into a brainstorming session around, because this is quite interesting for me. Technology is my passion. I might not have the authority in many aspects to spearhead, but we could perhaps look at some options, or I could give you my thoughts on an offline basis regarding.
Sure, looking forward to it.
Exactly. Thanks.
Thank you. So we have another question on chat. I will pass it. It's a question from a student, and I think a lot of people share it. The question is, how can we get involved into this kind of subject? You were very right. I mean, you ended your talk, Mohammed, with this quote about indifference. What is the opposite of love? So, and actually this is a big concern, but besides indifference is also this feeling of difficulty, of this huge gap between what you presented and what people can do. So a lot of people are interested in getting involved. But I mean, the question is, how can they do it? How do they start? I mean, you have done all these efforts, and I'm sure you can share some hints or some insights.
So there are two answers to that, Marius. One answer is that I'm happy to sort of put you in touch with people who are doing this. We would love to have a more formal engagement and opportunities But I also recognize, and I've learned this the hard way, that you cannot cut and paste a solution that is developed in one university in another, because of variety of challenges, academic structures, and things like that. And you have to give room for some local evolution of these things. So my answer to that is to do what I did, is to start doing it yourself and find champions. When I started this, I was certainly not ready to do everything on my own, and I was not capable. And it was driven by both a passion and an intellectual interest, and then learning from experts. So I routinely would go to seminars of people who are migration experts or who are sociologists, far from my own discipline. And that allows me to sort of think about how I can use my own training to do something. So my answer is, I'm happy to talk to anybody, help them on this path. But in some ways, I want to turn the question back and say, you will have to sort of do it and do the heavy lifting yourself with the help of others. There are no simple solutions where you can just become part of this organization. And that just doesn't work. Even if somebody says that they want you to become part of this institution and create a local chapter, it's not going to work. What will work is for you to really take ownership of that and create an institution with the help of others and with sort of other people lending a hand. But ultimately that will have to be done by you. There's no other way. If I were to say that I'm going to start a program at the University of Cyprus, I might even be able to start it with colleagues, but ultimately that will have to be locally owned in a way that works with your academic, social, political, economic environment. And that's the one that's going to be the most sustainable.
Thank you. I think you brought in your excellent presentation a viewpoint which is unique. I haven't seen, I mean, in presentations, it's very rare that you see people who are able to present the real spectrum of the complexity of modern problems. I mean, of course, everybody says, you know, the modern world has complex problems and they talk about them, but the way you did it is that you really presented the complexity at different levels or different layers. I mean, I'm an IT guy, so you know, I always think about layers. So, but I mean, you presented how the different, what are the challenges in different layers, and how these different layers or different levers intertwine together. And I think a meta challenge for us as academics, as universities, etc., is, I mean, how do we take this viewpoint into our own policy making, into our design, you know, how we educate people? Because you mentioned silos, and you know, I'm afraid that as we move on, instead of breaking down the silos, we built more of them, you know, administrative, bureaucratic, and whatever. And so this kind of, this viewpoint is very important, because it helps us realize, you know, what the directions we need to take in education as well. I don't know if you have any comment on
that. I think we all look at layers differently, Marios. Somebody who may come from a background in history may choose to look at different set of layers, and they will be valid as well. I think what I've learned to accept and appreciate is the tremendous complexity and respect for disciplinary expertise while hoping to look at an interdisciplinary problem. So I think in that regard, it's a fair thing. But you know, the biggest possible and the positive thing that has come out of this, in my opinion, is ability to work with people far from your own disciplinary expertise and background. And I think that is of tremendous value in enriching your own learning and your own perspective. And I think that's tremendously important. And I've learned that, I've benefited from that tremendously. And I think I can say that has been important in understanding it from, not from a monochromatic lens, looking at this from a single view of trying to force my solution, but let the solution, if there is one, emerge from the problem itself.
Yeah, but of course, I mean, you do this also getting out of the comfort zone.
Absolutely.
You know, the comfort zone of academia, the comfort zone of your own place, of your own university. And again, this can be, this is a big challenge. So now with COVID, how can you keep going with the engagement and the immersive learning that you have been doing? Because the challenges and the risks are very high. Have you given any thought of that? I'm sure you have, but I mean, have you found any solutions?
In some ways, you know, there have been challenges. There's no question. But in some ways, the opportunity to work with people through Zoom and other media platforms has allowed us to create these classrooms which are much more diverse and have a lot more students from all kinds of backgrounds than we had before. And that has been good. We have had a summer program and we'll have winter one as well on this area. So it's a learning process, Marios, to be honest, but one that we hope that we will be able to continue.
Great, thank you very much. So I don't know if there are any other questions from our online audience.
I also have to yes. leave, but
so we would like to thank you very much. We cannot upload on this platform, but I think it was really enlightening for us. I mean, your presentation, and we're going to share the video on YouTube with your permission, and
of course.
I'm sure a lot of good things will come out of this, and hope to have you with us on another occasion soon. So thank you very much.
Looking forward to it. Anytime, and I hope that your students and colleagues will reach out to me. I'm always available, and as I said, this is just like family to me.